7 more people tested positive for the coronavirus in the country Wednesday. All the 7 are Kenyans, 4 males and 3 females, 4 of whom had traveled from the US, UK and Congo.
We have 5 of these cases having been tested in Nairobi, 1 in Mombasa and 1 in Uasin Gishu. 2 of the cases emanated from our mandatory quarantine facilities, while 5 were picked up by our surveillance teams.
5 of the new cases were tested in Nairobi, while the other 2 were reported in Mombasa and Uasin Gishu. 2
of the cases emanated from our mandatory quarantine facilities, while 5 were picked up by our surveillance teams.
The ministry has further disclosed that 1 patient remains under critical care.
This is a Kenyan who was in critical care, who was on ventilator support. He has now been taken off ventilator support and required to celebrate the various doctors who have been aiding in his recovery. 2 additional cases have been discharged in the last 24 hours.
Private testing facilities will, however, be required to share the results with the ministry.
As a matter of law and invoking the Public Health Act, are required to share their results with the Ministry of Health for the purposes of monitoring this situation and ensuring that the proper notification is done in accordance with international health regulations.
As a new measure, all salon and barbershop operators are required to wear masks while attending to clients.
Further to this, we shall be giving further instructions on how you restrict the number of clients you have in a salon to avoid the crowding in our salons and barbershops.
The government had been monitoring 2,004 people, out of which 578 are still being followed up on, while the rest have been discharged.
It is likely that we may find many more Kenyans in the country who test positive. And so because of strained capacities in being able to put all these Kenyans in one place, one of the measures that we are looking to deploy within the coming weeks would be a home-based care protocol, where for mild cases we actually advocate for home-based care, and through our hotline and our different support structures, we will be able to monitor these patients and ensure they actually observe good self-quarantine measures at home.
A total of 5,278 samples have been tested since the first case was reported in Kenya. Caleb Ratemo, K24 Evening Edition.